All right, let's continue with this case, where we have axial MRI images of the liver. We can see two discrete focal liver lesions, each measuring about 3 to 4 centimeters in size. Both lesions exhibit relatively uniform high signal intensity on the T2 weighted images, which is a key feature here. On the non-contrast T1 weighted images, we see low signal intensity. Now, what's interesting is the lack of any conspicuous loss of signal on the out-of-phase images, ruling out the presence of fat within the lesions. Moving on to the post-gadolinium sequences, these images show progressive centripetal opacification of the lesions. Initially, the margins appear irregular, but as time progresses, they become more homogeneous and uniform. There's no evidence of a central scar, either on the T2 weighted image or on the post-contrast images. These findings are highly suggestive of benign cavernous hemangiomas, given the rounded, well-defined nature of the lesions and the characteristic enhancement pattern. To further reinforce the diagnosis, the background liver tissue appears completely homogeneous with no signs of cirrhosis. This is crucial, as focal lesions in a cirrhotic liver could have a much broader differential diagnosis. Importantly, the spleen is not enlarged, which makes conditions such as portal hypertension less likely. Now, in terms of differential diagnosis, we know that cavernous hemangiomas are the most common benign lesions in the liver. They typically have a very characteristic appearance on imaging. But if there's ever any doubt, especially if the lesions don't show the classical imaging features, we may need to consider other diagnoses like focal nodular hyperplasia or even hepatocellular carcinoma, depending on the clinical context. For instance, if these lesions were found in an older patient with a background of chronic liver disease, especially hepatitis, we might consider hepatoma. However, in this case, given the lack of cirrhosis or any other risk factors, a benign diagnosis seems much more plausible. If the radiological findings were equivocal, further imaging or even biopsy might be considered. But given the classic appearance here, most clinicians would be comfortable with a diagnosis of cavernous hemangiomas, and no further intervention would be required. Before we wrap up, I want to remind you to subscribe to Radiology Made Easy. If you've learned something today or have any questions about this case, make sure to drop a comment below. We love hearing from you. Keep engaging with the content because, as we know, radiology knowledge is all about repetition and applying it to different cases.